Hello and welcome to another quick video from me, the History Tutor, and in this video we're looking at the AQA topic, Britain helping the people, and we're going to be looking at some source skills and revising our knowledge of surgery in the Industrial Revolution. So in this short lesson we're going to be revising our knowledge on Lister and surgery in the 1800s, in particular focusing on how to deal with infection. Then we're going to look at a how useful source question in detail, how to answer that question successfully. So firstly, revise your knowledge on Lister using my revision guide, then come back for a quick quiz, and then we'll go through our source skills. Let's go to a quick quiz now to test our knowledge on Industrial Revolution surgery. So here is a word search. See if you can find 10 words associated with surgery in the 1800s. And as you can see in the revision guide, you can make a note of them and see if you can define the keywords and or say why they're important. Pause me now and give it a go. Okay, so here are the answers then. So first we could find anaesthetic. Now anaesthetic obviously is important in this era because not only are we dealing with pain relief, but also the patient is knocked out. So we could think about Simpson and his great discovery of chloroform. And of course you can find James Simpson there in the word search as well. So Simpson, obviously by a bit of luck, experimenting with some different chemicals, managed to knock himself out and realised the great discovery he'd made. Chloroform was his great discovery, and this was the chemical that knocked people out. But remember, if you can find Hannah Greener in there, unfortunately she died of an overdose of chloroform. And then the next person on the list is John Snow. John Snow made a chloroform inhaler that made it safe to use, and John Snow importantly was the anaesthetist for Queen Victoria, who he managed to help have babies in a less painful way. And obviously Queen Victoria ended the opposition to chloroform by saying that this anaesthetic was great, and it ended lots of church resistance in particular. Now Joseph Lister is your next person, and we're going to focus on him today because he tackles infection and develops aseptic surgery. So his infection is stopped by using carbolic acid, and that's the next word to find. And obviously he does an experiment on a boy who breaks his leg, and he doesn't amputate the leg, but he resets the bone and wraps in carbolic acid and bandages, and it's a great success. The boy does not get an infection and does not have to have his leg cut off. So he used this carbolic acid in his surgery, spraying it around the operating theatre, as we'll find out about today. And he then develops aseptic surgery from this. Once it's proven that bacteria cause disease with Pasteur and Koch's great work, we have aseptic surgery, metal tables, clean surgeons, clean robes, and part of that is the discovery of rubber gloves, and you can find that in there as well to make sure there's no dirty hands on the patients. So let's look at the question now. So the question says, how useful is source A to the historian studying the improvements made to surgery in Britain in the 1800s? Use source A in your contextual knowledge to explain your answer. So let's have a think about those command words and the phrasing in the question. What do you think you need to do to be successful to answer this question? So have a look at the source question here and some of the command words and list what you think would be a good success criteria. So you'll notice space in your revision guide, so jot down some ideas now. Okay, so here's some of the ideas I've gone for. First, it's really important to make an argument. So we need to start by making a point about how useful the source is. The source is very useful because. Then we need to give some evidence to back that up. So normally we might start with the content of the source, what we see in the source, what we've read in the source, and give a message from it. For example, the source shows this. Then we give a reason why we think that is useful or not useful. Remember, we're creating an argument here. This is useful because, and we give our opinion. Then prove that idea with some knowledge. So I've said explain with knowledge why this is useful. So this is useful because, give your opinion, then back it up with some knowledge. Now, candidates who do 2 ideas about the source content, the message in the source, can get 6 marks if they've explained with their knowledge. However, if you want the top band of marks, actually, in some cases, this can be a bit easier. Give an explanation of the source content and message with some knowledge, and then give an idea of the provenance, where the source comes from, who made it, why they made it, etc. That will get you maybe 7 marks. Your last mark is reserved for giving your final judgment. Overall, this source is very useful because. So let's do a little bit of planning now, shall we? So in your booklet, you've got the source there. So I'd like you to annotate around the source what you see in the source that you think is useful, just in terms of the content at the moment, and then what knowledge you might use to back up your idea. What do you know about Lister and surgery? So pause it now and give it a go. Okay, so here's what I've come up with. Firstly, we can see that anaesthetic has been used. There's a man there holding something over the patient's face, and the patient seems to be still and asleep. And we know that James Simpson had discovered chloroform as an anaesthetic in 1847, and Snow had made this safer in the 1850s. We've got knowledge to back that up. We've got a sheet over the dirty table. So things like Nightingale had proven that sheets and clean hospitals were important, so we could bring in something like that and so extra wider knowledge. However, we've got a negative here as we go round clockwise round the source. Aseptic surgery was not developed yet. Surgeons still wearing dirty clothes. There's no gloves. So we know that the gloves were not developed, rubber gloves were not developed until 1894 by William Stuart Halstead, if you want some really detailed wider knowledge. And then finally we can see the spraying machine, spraying carbolic acid around the theatre. And we know that Joseph Lister used this from 1867 to about 1870, and his death rate dropped from 45% to 16%. And we know he obviously had that great success. So next, let's have a think about the provenance. So this is the box normally that goes with the source. In this case, it says source A, an engraved picture from 1870s showing Joseph Lister using antiseptic during surgery. Have a think about what this is, when it's from. Do we know anything about who it is? Do we know anything about the purpose it has? What could we pick up as ideas about the usefulness of this provenance? Pause me and work out some ideas. Okay, so here's my ideas. So when, we know. Okay, so it's from the 1870s. So by this time, Lister had proven that carbolic acid reduced deaths from surgery in 1865. He successfully used it when operating on a broken leg. And also we know his stats from 1867 to 1870 that reduced from roughly 50% down to 15% death rates due to infection. So we got another idea of when. Obviously published in 1870. This means it was published too early to include aseptic surgery. Rubber gloves, for instance, weren't developed until 1894. We know Koch had not proven that germs cause disease until late 1870s and 1880s, with people identifying bacteria and really rejecting old theories like spontaneous generation. So we've got lots of potential provenance to use. So how do we write this then? So we should structure our answer still in our P or paragraph. So source A is quite useful, or source A is very useful about the improvement made to surgery because. Then we give evidence, for example, the content shows, or you can start with the provenance, whichever flows best for you. And then this is useful about improvement made surgery because explain with some facts and knowledge, and you could do a furthermore or however in there as well. Come up with your opening sentence now. So think about how you might start this. So source A is very useful about improvement made to surgery because. Okay, I'm going to start with provenance because I think that flows better. So maybe have a think about a provenance idea, if you like, about how when it was published might be important. Okay, got your idea? So here's my opening sentence. So I've said source A is very useful about the improvements made to surgery because it was published at a time when many improvements have been made. For example, and then I want to talk about the provenance. So what could I say about the provenance about when it was made? I think it's relatively simple, really, isn't it? So pause me now and see if you can jot down some ideas about the provenance. Okay, as I said, very simple. As you can say, for example, provenance of a source is from the 1870s. Okay, that's very simple. But then let's explain why that is useful about the improvements made to surgery. So this is useful about improvements made to surgery because, and we need to maybe explain some knowledge about the 1870s. So pause me now and give it a go. Okay, so I've written, this is useful about the improvements to surgery because by this time Simpson had developed anaesthetics and Lister had successfully used carbolic acid. So obviously we know, therefore, don't we, that some improvements have been made. Okay, I'm going to go with a however, that it's not totally useful about the improvements made to surgery as, okay, could you think of a however? Maybe pause and think about a way in which the provenance is not useful. So I've written, however, it's not totally useful about the improvement made to surgery as some improvements were developed after the 1870s. For instance, aseptic surgery developed after Koch improved bacteria caused disease. This led to med tables, surgeon scrubs, rubber gloves from 1894. So it's not going to be totally useful about the improvements made to surgery. Now, that's a lot for a provenance paragraph. To be honest, you'd probably just have plenty without the link and write quite a short paragraph. So let's now think about the content. So what would you say for the content? So do you think it's very useful about improving major surgery, and why? What bit of content are you going to pick out? Explain with some knowledge about why that's useful. Okay, try and at least do a point evidence explain. If you can do a link, great. But remember, we probably need to explain one idea about the source and one idea about the provenance to get the top marks. So pause me now and write the whole paragraph and then look at the example. Okay, so here's my example paragraph. So source A is very useful about the improvements made to surgery because it shows that Lister had begun to tackle the problem of infection in surgery. For example, the content shows the machine spraying the carbolic acid, and obviously the patient's knocked out by chloroform. This is useful about the improvements made to surgery because it shows that Lister built on the work of Simpson to reduce infection in surgery. His death rate dropped from 45% to 15% while using carbolic acid. This meant surgeons could start more complicated surgery with more safety. That combined with the provenance is probably plenty to get yourself to the top band. But if you want to guarantee your marks, one more sentence with a furthermore can really guarantee them. Maybe a nice simple point evidence explain idea to develop your argument. Now, time to simply conclude with an overall, the source is, and conclude your idea. Well, I hope you found that video useful and you've managed to revise your knowledge on surgery in the 1800s and also work out some more skills around the source question also for the AQA exam. If you did find it useful, have a look through my playlist. There's lots of other videos to help you with your knowledge and your skills, and also do take a look at my revision guide. There's a link to it in the information for this video as well, and you can buy this and have access to more videos, notes, and lots of help for your GCSE exam. Well, I hope you can see you again soon. Bye bye for now.